Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Topic is 7 HIV groups and treatment. What I mean by 7 HIV groups is just a way that people have been grouped based on their lifestyle, based on their occupation, what they do, into 7 groups, and they have been found to be very vulnerable. It's a very serious risk factor. They are vulnerable to having HIV infections. It won't be a very big surprise when you talk about a member of that group as the homosexuals or gay people, those who indulge in men-to-men sexual activity. If you have a lifestyle that is in that direction, and right now you have tested negative, it's also advisable that one should change his lifestyle first, even before any other precautionary measures are taken. One of the most important is that you have also social sex workers, that is, we used to call them prostitutes, but now the same name is social sex workers. They are also in this group that are prone, so that if you belong to the group and you are not yet HIV positive, there is a need for you to really look at the measures, the preventive measures that is necessary for you to take, so that you change your lifestyle. The treatment is another area, because people who are in this group also have a problem of building resistance to drug. The reason why that is will be explained in the slide session, and what kind of treatment that one can take, and the laboratory effort at confirming that somebody has it is also very necessary, because the laboratory, if you are testing for the antibodies, you may find that somebody has the virus but it is not displaying the antibody. So if you use the antibody test alone, you might get it negative, whereas the person is still positive with the virus. We have come to understand that the CD8, that is T lymphocytes that attacks, they are called killer cells that kills these things, are produced in large number in some people, and they mop up the viruses, so thereby making your test, antibody test, almost not detectable, negative, whereas the HIV virus, which could be detected with the viral load, may remain positive. All that I shall expose and explain in the slide session. But as usual, these 7 groups we need to know the 7 group, and if we belong to the 7 group, vulnerable group, we may need to change our lifestyles, and that is the advice. So click on the like button as we move on to the slide section.
The outline: objective introduction, 7 vulnerable groups, laboratory, diagnosis, prevention, and treatment are all I shall be talking about. The objective: to create more awareness of the 7 vulnerable groups of people. The laboratory tests for early diagnosis for effective management of the disease. Introduction: HIV is a retrovirus that has used the reverse transcriptase to penetrate the DNA to capture it or to propagate itself, that is reproducing itself and attacking the immune system. The HIV infection has been unbelievably in existence and still virulent since Simon isolated and identified them in 1983. Some vaccines produced were found to be aiding the spread of the disease around 2008 as reported. HIV affects people from all ethnic groups, gender, ages, income, and level. Some groups have been significantly affected by the AIDS epidemic. Vulnerability to HIV infection is influenced by a complex interaction of biological, behavioral and structural, social, economic factors that disproportionately affect certain groups. This factor, rather than a single scientific explanation for each group, create a higher risk for exposure and transmission. The vulnerable groups to HIV. Group 1 is very popular, men who have sex with men. And the primary scientific explanation for increased vulnerability is the physiologic of anal sex, which has a higher likelihood of transmission than vaginal sex due to the delicate rectal lining being prone to microabrasion. The next group are people who inject drugs, PWID. The main biological and behavioral factor is the sharing of contaminated needles, syringes, and other injected equipment. The next group will be women. Women are biologically more susceptible to HIV infection from male to female heterosexual intercourse. We may also put the social sex workers they are the danger of female to male due to a larger mucosa surface area and higher risk of microabrasion during sex. This is exacerbated by social factors such as gender inequality, economic dependence, and intimate partner violence, which can make it difficult for women to negotiate safer sex practice or access testing and treatment. The fourth, people of color, that is African, American, and Hispanic Latinos in certain regions. There are no inherent biological reason for this. Even in Africa, West Africa, you have the HIV one predominant. The vulnerability is rooted in social and structural determinant of health. It can also consider the historical mistrust of the healthcare system. This factor leads to reduced access to quality prevention and care. Poverty is also a very good reason because there are higher rates of poverty, unstable housing, racial discrimination amongst people of color. 5, people with other sexually transmitted infection. It has been discovered that they are prone to easily be infected, especially when you look at opening sores or inflammation like syphilis or herpes sore. Significantly increase the likelihood of both acquiring and transmitting HIV. The biological presence of this sore provide an easier entry point for the virus. The sixth, infants and children. Vulnerability primarily arises from perinatal transmission, that is mother to child, during pregnancy, childbirth, or breastfeeding. The scientific advance in antiretroviral therapy for pregnant women and infants have dramatically reduced this risk, highlighting the importance of access to medical care as a vulnerability factor and early treatment. Because if that could happen, it means if there is early treatment too, that will save anybody. People in prison and other closed settings, displaced population, migrants. This group face increased vulnerability due to living conditions that includes limited access to healthcare information and prevention, like condom and need clean needles, where those who are injecting themselves. Factors like this, disrupted social network, poverty, and legal barrier often compound their risk. Hemophilia as well could also be listed to another group because they bleed easily, and with that kind of situation, it's very easy to really be infected. Laboratory diagnosis. The HIV is easily transmitted, especially through means, the blood and the body fluids. So the best way to really prevent the HIV staying forever in the body or even becoming AIDS, it's a rapid or early detection, a rapid screening test that will detect the virus infection early. It has been discovered that P24, the core protein, is produced at the within the first week to second week. It might even go hidden. The latent phase can be for weeks, months, and stayed even for years that we show nothing. So the period that is latent, you now find the antibody testing probably showing, not even showing any positive results. And this is why it's very necessary to also check other variables. So the blood test involves ELISA test and confirmed by PCR. The lymphocyte count is also indicative of a serious problem. The total count could be as low as less than 4,000 per mil. The B cells could be in that region, but what you are looking for is the CD4 count and the CD8 if possible, as well as the viral load. The viral load is very important, where the CD4 count is less than 200 per microliters. So you want to be sure that this person is really having HIV infection, really destroying the CD4. The CD4 is the first the reaction, cell-mediated reaction against the HIV virus, and it invites the killer cells, the T lymphocyte, the CD8. And so the ratio of CD4 to CD8 at times, when it is lower than 1, is indicative of infection. The treatment. Prevention has the acronym ABCD. A is for abstinence. B stands for blood transfuse must have been screened for HIV. C is to use where you feel condom as protective. And then D is about drug injection using sterile needles and not reusable ones. Some people are reportedly cleared of HIV after using antiretrovirus drug, and viral load shows no virus detectable. Research explained this. CD8, which is the killer cells, the cytotoxic cells, are those that respond to HIV infection by replicating and attacking cells that are infected with HIV. The increased level of these CD8 T cells are particularly interesting because these are the cells that are responsible for clearing virally infected cells from the body. So if you see such a situation, it's most likely looking for the CD8 and how to boost the immunity of that patient. Finally, it has been found that vulnerable population people harbor drug-resistant viruses, and this could be easily explained that because treatment adherence challenges, they have that suboptimal adherence to the prescribed antiviral therapy regimen is a primary driver of acquired drug resistance. So because of their socioeconomic status, the lack of access to healthcare, stigma, and majority of people in that category don't want people to know that they about this. Then 2, there is transmission of resistant strain. Individual in high-risk group, those who like men-to-men or social sex workers will continue their job because that's their only means, and so they are prone to have different type of these virus. So in the process, the resistant strains are transferred to them. Late diagnosis is also a way because and treatment gap. When they don't come for treatment, the virus will also assume resistance. Then the specific drug exposure. At times, those exposure drug that they are using could have created resistant strain, and so the level of resistance to treat them becomes a serious problem. This is not my last production. It's the 210th video on health matters, especially concerning medical laboratory aspects. So feel free to look at more of my videos and also subscribe, like, and more will come.